Synovial joints. Synovial joints are the most common type of joint in our body, and in most cases are what we think of when we hear the word joint. So you instinctively may think of your shoulder or the elbow, the wrist, the hip, or the knee, or some other part of your body. And that's really what's going to be a synovial joint. So they're very abundant, and it's got a lot of characteristics that we're going to go over in more detail later on. But for right now, I want to get across the concept that this type of joint, a synovial joint, is going to be freely mobile, and it's also going to be called diarthrotic. So di is going to be multiple, and arthros means joint. So this is a joint that can move in multiple directions, and it's going to be very mobile and or freely mobile, quote unquote, as it's able to move in a large variety of different types of motions. Now, a general characteristic that I want to discuss when we talk about synovial or diarthrotic joints is this concept that as a joint becomes more mobile, it is going to be less stable. So let's compare our shoulder to the hip. The hip is going to be a perfect example of a less mobile joint that offers more stability. So this is going to be an inverse relationship. As we start to gain mobility, we're going to lose stability. Or you could think of it as we become less mobile, it's going to become more and more stable. So let's look at the shoulder first. And what we're going to see if we activate one of these muscles and turn on its motion, we're going to see the action of AB or abduction. And you can see the wide range of motion that our upper limb offers here at the shoulder joint. We're able to have the upper limb positioned down by the side of our body, all the way out, and then above our heads. And this is going to be a great example of a highly mobile joint, but one that is often quite unstable. Now, you may know somebody, or you may have experienced this yourself, of a shoulder dislocation, and they're fairly common. Now, the reason why is as we look at this, it's a type of joint known as a ball and socket joint. And here we see that the ball is much, much larger than its accompanying socket. And what this means is we're going to have a high degree of movement offered at this joint, but it's also going to be quite unstable because it allows for so much mobility. Now, that's going to be different than what we're going to see here at the hip. And if we were going to AB or abduct the hip, what we would see is a far more restricted range of motion. Now, obviously, some individuals are incredibly flexible and they might be able to continue to raise that lower limb quite far. But this shows this example quite well, that this is a far more stable joint, but it's also far more immobile. We can see that the head of the femur is going to be the ball of this ball and socket joint, and it's going to fit in a cup in the hip. And this is going to form a very tight connection, and it's going to be very, very strong, which is good because it's going to allow for weight transfer from our lower limb up to the vertebral column. Now, the difference in these is we have different desires of being a bipedal creature, of walking around, but also being able to move our hands in a wide variety of orientations. So the way that these joints have developed is going to give you an idea of their function. But just remember that concept of more mobility, which is less stability, and less mobility, which equals more stability, for overall concepts of synovial or diarthrotic joints.